Have you ever pondered how common dysphagia or difficulty swallowing is after a stroke? It's a question that's not often asked, but the answer is unsettling. In fact, according to various peer-reviewed studies, more than half of all stroke survivors grapple with dysphagia. That's a significant number, reflecting a serious impact on the quality of life for these individuals. Imagine, for a moment, the simple pleasure we derive from eating and drinking. Now think about the challenges and frustrations that arise when that simple act becomes a struggle. That's the reality for many stroke survivors. The truth is, dysphagia is a common sequelae of stroke, affecting both physical health and emotional well-being. Moreover, the repercussions extend beyond the individual, impacting families and healthcare systems alike. It's a ripple effect of care, cost, and concern. So yes, the prevalence of dysphagia post-stroke is a serious concern and demands our attention. Now, you might be wondering, what causes dysphagia after a stroke? Well, a stroke can cause damage to the parts of the brain that play a crucial role in the process of swallowing. This can lead to dysphagia, a condition characterized by difficulty in swallowing. When a stroke affects the brain's control over the muscles used for swallowing, it can lead to various complications. These include aspiration, where food or drink enters the lungs instead of the stomach, potentially leading to serious conditions like pneumonia. So how can you tell if someone is experiencing dysphagia? The symptoms can vary, but some common indicators include coughing or choking while eating or drinking, and having difficulty controlling food in the mouth. Some individuals might also experience a sensation of food being stuck in the throat or chest. Understanding the causes and symptoms of dysphagia can help us take proactive steps towards timely intervention. So, how can we address dysphagia after a stroke? Well, several interventions are available to tackle dysphagia post-stroke. First off, specific exercises can strengthen the muscles used during swallowing, improving coordination, and reducing the risk of aspiration. Additionally, changes in diet can make a significant difference. Liquids can be thickened and foods softened to ease swallowing difficulties. Moving on, swallowing techniques can be taught. For instance, the chin tuck method, which involves tucking the chin to the chest while swallowing, can help direct food down the right path. Now let's talk about the unsung heroes in this journey: speech and language therapists. Their role is crucial in diagnosing and treating dysphagia. They assess swallowing abilities, prescribe tailored exercises, and recommend suitable dietary modifications. Ultimately, it's a team effort between the patient, their loved ones, and healthcare professionals. With the right interventions and the help of speech and language therapists, managing dysphagia becomes a less daunting task. Let's take a moment to summarize what we've learned about dysphagia after a stroke. We've learned that dysphagia, or difficulty swallowing, is a common issue following a stroke, affecting up to half of stroke survivors. It can be caused by various factors, including damage to the areas of the brain that control swallowing. The symptoms can vary, but they often include coughing or choking when eating or drinking, a feeling of food being stuck in the throat, and changes in voice quality after eating or drinking. Recognizing these symptoms early is crucial for timely intervention and treatment. We also delved into the role of speech and language therapists who can help stroke survivors regain their swallowing abilities through a range of interventions. These can include exercises to strengthen swallowing muscles, dietary modifications, and techniques to make swallowing safer and easier. Dysphagia post-stroke is a significant issue, but with awareness, understanding, and the right support, we can make a difference in the lives of those affected.